From the food we eat, the air we breathe, the land we dwell, to the health of our body and mind and the well-being of all things in the universe. Unlock the science with Chula Radio Plus.
Hello, this is Unlock the Science, and I'm Lawan Jirasuradit. In the era before modern medicine, living a ripe old age was a privilege, gifted to only a handful of people. But nowadays, thanks to our advanced medical science and technology, most of the world's population now enjoy better living conditions and live a longer life compared to any precedent generations. Nevertheless, as more and more people are blessed with longevity, we are now facing with another kind of problem of having too large an elderly population in the society. This problem of aging society, as many countries, including Thailand, are currently struggling to cope with, comes with it many socio-economic consequences. United Nations defines an aging society as a situation when a country sees its population of those aged 60 years or over accounts for more than 10% of its overall population. Thailand has already passed this milestone and become an aging society since 2007. However, if the proportion of the 60-year-old or over surge to 20%, the country will be seen as an aged society. And if this population groups amounts to 28% of overall population, then the situation will become a super-aged society. According to population surveys carried out by National Statistical Office of Thailand, which is a government agency, the number of 60-year-old or over people in Thailand has been constantly rising. In 1994, Thailand only had around 4 million of senior people, or 6.8% of its total population. In just a period of 20 years, this proportion more than doubled to almost 15% in 2014. It further rose to 16.7% in 2017. The latest population figure, as of December 2020, shows that the number of elderly people in Thailand has reached 11.6 million, climbing up close to the 20% of its overall population of 66.2 million. In light of the surge of senior people over the past decades, the National Statistical Office of Thailand has estimated that the country's elderly population will reach 20% and Thailand will become an aged society by the end of 2021. It is further projected that Thailand will eventually become a super-aged society within 10 years from now, as the ratio of aged population will constitute the 28% benchmark in 2031. In contrast to the rapidly rising number of old-age people, Thailand's birth rate is in decline, worsening the aging society situation. World Bank's statistics shows that Thailand's total fertility rate has constantly been dropping from around 6.1 during the 1960s to only 1.51 in 2020. At this fertility rate of 1.51, Thailand population will be shrinking, as the number of newborns cannot replace the number of the deaths. Thailand's declining birth rate will result in fewer children in the country. Office of the National Economic and Social Development Council, which is Thailand's top economic and social planner, has estimated that Thailand's children population ratio will drop from roughly 17% in 2020 to about 13% in 2040, while elderly population is expected to rise to about 31% in the same period. Because of such demographic changes, Thailand is facing with many adverse impacts to its economy and society. One of the most directly hit sectors is the labor market, as the share of working-age people from 25 to 59 years old is projected to fall from 71% of the population in 2020 to 56% in 2060. This decline is equivalent to a loss of nearly 30% of working-age people in Thailand, according to an estimate by World Bank. World Bank has cautioned that the declining workforce will cause a decrease in the growth of income per capita and lead to long-term economic downturn, which will consequently affect the pension plan and financial security for many retirees. Aging society is certainly a complex issue. Unlock the Science reporter Prachuabmoh discusses in detail with Professor Dr. Vipan Prachuabmoh, Dean of College of Population Studies, Chulalongkorn University.
Why the increasing proportion of senior population is impactful to our society.
Thailand is an example of developing country that is getting old before getting rich. Thailand is the second most rapidly aging in Southeast Asian countries and ranked number 9 in Asia. The number of populations ages 60 and above is about 12 million and is projected to increase to over 20 million by the year 2035. The older person will constitute over 30% of the population. Population aging in Thailand will become far more pronounced in the coming decades. The share of older persons among the total population has been increasing, but the proportion of the oldest, aged 80 years and above, is also growing. Population aging also leads to a continuously declining proportion of children and working age group, in conjunction with a sharp increase in the proportion of aging population, leads to an imbalance in population age structure. Such population aging speed imply that Thailand will have a relatively short time preparing the social welfare and services to respond to the aging societies.
As you have mentioned about the imbalanced structure of our society, many studies suggest that we are going to be a fully aged society this year. What do you think is the main concern of phenomenon for Thailand?
On the bright side, population aging is a success story. Thai people today are living longer and generally healthier lives. Population aging represents a triumph of public health, medical advancements, and economic development over disease and injury constrained human life expectancy for thousands of years. One of the opportunities of aging society is that Thai families have a chance to live together with many generations. The older peoples can also contribute to community longer with their repository of knowledge and lifelong experience. They can also contribute to their families in various aspects, such as family advisory, household chores, grandchild care, etc. Anyway, rapid population aging also pose new challenges to families, community, and country as a whole. Aged society imply not only there will be more older person and living longer, but there will be, on average, far fewer young person to support them during the old age. One of the concerns at the national level is the dramatic decline in the number of population in working force age group and the ratio of working age population to the population in older ages. Such age structure shifts may lead to workforce shortage, declining productivities, shrinking tax base, economic growth slowdown, and increasing social pensions. Another concern addressed prediction made about rising demand for healthcare services and healthcare costs due to more a considerable number of older persons in society. This population dynamic pose serious challenges for traditional family support system in Thailand, and also pose a challenges to the community's ability to provide backup support for older person, and also pose challenges to government policies. Yeah.
Do you think what we should do to mitigate this challenge?
Yeah, in order to mitigate the challenge from labor force shortage, I think one way we can do is that increase the quality of workforce. Yeah, because I think in the near future, we will have some kind of technological transformations. We need the labor, not in terms of number, but in terms of quality. So we need to invest more in terms of human capital. We have to think in terms both quantity and quality of the population as well. But I think in the near future, we have to think more in terms of very good human capitals. Yeah.
As you have said that a lot of older people is getting poorer due to the economic decline. As a result, do you think the Thai family right now is capable of looking after the increasing elderly in the society?
Yeah, I think in Thailand, we still keep the tradition of filial support, right? Filial pieties. So it means that the young generation or the children try to take care and look after parents in the old age. But nowadays that I really concerned is that we have lower fertilities, right? Next cohort of the older person will have fewer and fewer number of children. So they may not be able to rely on the children due to they have very few children. Some of them have no children. I mean, some of older parents, we see a tendency of increasing the number of older person who do not have any children or even not married at all. So they have to stay alone or have to stay with the couple. So in that way, the family may not be only source of support. We have to think about the other ways like the community support system or the government support system as well for those who live alone or living with the couple only.
We will take a short break now.
You are listening to Unlock the Science on Chula Radio Plus.
After spending long years of adulthood, working to earn money for oneself and his or her family members, people usually allocate a portion of their income as savings for retirement. In Thailand, not all workers are covered under the government's Social Security scheme, which provides a certain amount of pension from the workers' mandatory saving program for their retirement. For the more generous state pension, only government employees are entitled to such benefit. Therefore, not many Thai senior people are financially prepared for life after retirement. Many of them have to depend on the income of their children or have to continue working after their retirement age. As Thailand is encountering the rise of aging population, while most of its people do not earn high income, World Bank has cautioned in its report that many senior Thai retirees do not have sufficient retirement savings, causing them to become financially insecure. A recent survey by the Bank of Thailand, or the Central Bank, found that 41% of the respondents did not have any pension savings plan, while 29% of the respondents aged 60 years or over were still in debt. Another survey by the National Statistical Office also found that about 1/3 of people aged 60 years or over had an income lower than the poverty line of 30,000 Thai baht, or around $910 per annum. To make it worse, The devastating COVID-19 pandemic in Thailand in 2020 and 2021 has rendered the financial situation, as well as health and well-being of senior citizens, even more vulnerable. A survey on the COVID-19 and older people by the College of Population Studies, Chulalongkorn University, found that during the pandemic, fewer elderlies were able to rely on their work income, and fewer of them could rely on their children's income either. During the pandemic, a large number of people in many professions have either lost their jobs altogether or have their income cut considerably. Therefore, many elderlies have to rely on the old age allowance of 600 to 1,000 Thai baht, or around $18 to $30 per month, which is a welfare provided by the government for those who are 60 years old or over. However, this amount of money is inadequate for the cost of living, even in rural areas. Professor Dr. Vipan is also the head of Chulalongkorn University Platform for Aging Research Innovation, or in short Chula Ari, which is an initiative integrating the university's various fields of studies to formulate plans and projects for the elderly in Thailand. It aims to help the country mitigate problems arising from the aging population, as well as better taking care of older people. Unlock the Sign reporter Prachuabmoh talks to Professor Vipan more about the works under this initiative.
Could you please tell me more about the story behind Chula Ari project and how and why this project has been established at the first place?
The mission of Chula Ari is to integrate the university or field of study and other relevant participants to proactive support the aging population. The Chulalongkorn University Platform for Aging Research Innovation, or Chula Ari, is a project that combines various fields of study within Chulalongkorn University to maximize the benefit of knowledge extension and to proactive develop research and innovation on the elderly. The finding of the research project will be used in development of policy and system for aging societies to improve the quality of life of the elderly and forge the connection with educational institutions and networking organizations outside the university, including public sector, private sector, civil society, both at national and international level, creating a cooperative system, mechanism, and innovation to support the aging society and promote the well-being of the aging populations. Yeah.
And how Chula Ari project operate to help the older people?
The Chulalongkorn University Platform for Aging Research Innovation adheres to these three main tasks to tackle an aging society's challenges. The first task is formulating the third national plan for older persons as a long-term guideline for proactive geriatric work. We create data-driven policy that reflecting the need of the present and the future older person. The second is developing database system for policy planning and action research on population aging, communicating research and raising awareness to the public. And the third task is conducting action research to develop multidimensional system to respond to an aging society. The basic concept framework of the action research is how to make the current and the future generation of older person as independent as possible, and how to enable them to live with their families or participate in society as long as possible, and live in their choice of housing and community in the final years of their life. Therefore, the system should not be support-based, but focus on individuals' ability to be independent as long as possible. Furthermore, if they cannot be self-reliant, there should be a support system in place that focus on empowering people, families, and communities. Yes.
As Thailand is currently under the COVID-19 pandemic, what are the impact of the COVID-19 to the Thai senior population?
Okay. For the outbreak of COVID-19, older persons are at the most risk for severe illnesses and death than other groups of population. Countries with population aging are more likely to experience greater level of infection and deadly, as you can see in United States, in Spain, in Germany, or in Italy, which may due to health deterioration and declining immune system with age. The College of Population Study conducted 2 surveys in 2020, right after the first wave of the COVID-19 outbreak. The main findings from these surveys are older person income from work, children interest has been decreased during the COVID outbreak. Older person in urban area, especially Bangkok, were more likely to experience low income than in rural areas. Older person also has psychological problems such as feeling worried, lonely, and unhappy. They're concerned about their worse health due to missed medical appointments or being inactive due to staying home. Their family financial situation. They also fear that they and their family members would contract the coronavirus. One of the interesting findings is that the old age allowance, maybe you may know in Thai as Bia Yangชีพ, became one of the vital source of economic security for older person and family, especially older person in urban poor. Although old age allowance is relatively tiny amount, it is better than nothing in a crisis. In my opinion, as Thailand continued through the COVID crisis, a social safety net system for older person and their family need to be developed at many levels. And Chula Ari is preparing to help older person in the restoration process after the end of the COVID crisis. And we are also trying to seek proactive policy and systems to respond to aging society in the context of disruptive changes.
Professor Vipan said, Thailand is a developing country that will be getting old before getting rich. The country is the second most rapidly aging in Southeast Asia and ranks number 9 in Asia. Her works at Chulalongkorn University Platform for Aging Research Innovation, or Chula Ari, are now mainly research and development. Chula Ari has helped formulating a national plan on the elderlies, creating database of senior people in some community in Bangkok, and conducting action research for the independent living of the elderlies now and in the future. It is clear that the rise of aging population, together with the plunging birth rate, is a big problem for Thailand, while the workforce is shrinking, which could disrupt economic growth. The country has more older people to be taken care of. In coping with the challenges of becoming an aged society, the Thai government in 2020 set the issue of aging society as a national agenda and has drafted a master plan on the issue. Among others, the plan aims to promote savings among working people for their retirement and improve health care for older people. Despite such a master plan of the government, Professor Vipan cautioned that not all health and social aspects to safeguard the well-being and social inclusion of senior people are included in the measures. She said the government needs to ensure that the elderly can access all aspects of healthcare and social supports, as to achieve the goal of healthy, productive, and happy aging population. Unlock the Science would like to thank Professor Dr. Vipan Prachuabmoh, Dean of College of Population Studies, Chulalongkorn University, for her insights into this alarming issue of aging population. I hope you enjoy our program. You can listen to Unlock the Science on Chula Radio Plus at FM 101.5 every Saturday from 1 p.m. to 1:30 p.m. You can also listen and follow us on our website, curadio.chula.ac.th, and our Facebook page. And our program is also available as podcast. See you again next Saturday. Have a nice day.
Unlock the Science is edited and produced by Sinfa Tunsarawut with Lawan Jirasuradet as the program host and co-producer.